Hi there, my name is Gillian Brown. I'm an osteopath and I run the Harpenden Injury Clinic. I've got a special interest in tennis and I'd like to talk to you about tennis injuries today. I used to be a tennis coach, a professional tennis coach, and I've also represented Great Britain in the seniors age group. So I want to talk to you about a really common tennis injury called tennis elbow. Tennis elbow, first of all, is a repetitive strain injury in the extensor muscles of the forearm, and it's generally caused by improper technique at club level. So the first and foremost thing that I would recommend to a patient is to go and get your tennis strokes looked at by a professional tennis coach, ideally on an individual basis. They can video your strokes and find out if you're doing anything specifically where you're straining the forearm. The common things that we see is that people don't use their arm too much, and particularly the extensors of the forearm and the backhand, rather than using the whole body. So if you look at the professional players play, they're creating power through using their leg muscles, their trunk, and the arm is just an extension. So that's the first thing in terms of looking at the root cause of the problem. Other advice that I would give is to make sure that the racket is nice and light for you and that you have the correct grip. If you're using a grip that is too small, you could be over gripping the racket and therefore putting extra strain on the forearm muscles. Next, make sure that you've got the string tension at the right tension as well. So you should really be getting your strings restrung every year. Also make sure that the balls that you're using, the tennis balls, aren't wet and fluffy, because they'll carry extra weight, and then that's also going to put strain on the forearm as well. And in terms of what I can do as an osteopath, as well as diagnose the injury, I can then give you some treatment in order to relax the muscles of the forearm in the form of massage. And then I would then give patients exercises in order to stretch and strengthen the forearm. So two common stretches are that if you're left-handed like myself, that you would extend the forearm, taking the wrist back, and then you put a stretch onto the forearm muscles and you'd hold that for at least 30 to 60 seconds. So that would be forearm stretch, and then we can also do the flexor stretch as well, which where we take the wrist back so that we're stretching the opposing muscle group, the flexor muscles. In order to strengthen this area, which is really important in terms of prevention in the future, we can also use our racket for this. We'd then lean our arm over a table in order to lock out the elbow muscles or the elbow joint, and then with a small weight, you can even use your racket for this, 5 seconds down, 5 seconds up, you're then extending the wrists and flexing the wrists. So you'd want to do about 15 repetitions of that. And then finally, I would make sure that you didn't play any tennis until you get the area, until the area recovers.